Question number 4, the Honourable Annette King.
Thank you. My question is to the Minister of Health. Does he stand by his statement on the 29th of July that core Crown health expenditure covers, quote, most but not all inflationary pressures, end quote, and what impact has this shortfall had on patients?
The Honourable Dr Jonathan Coleman.
Mr Speaker, I stand by my comments in the context that they are made. Inflation is at 0.4%, meaning that the 0.6% contribution for inflationary pressure is actually above the rate of inflation. In terms of impact on patients, this government is delivering 50,000 more operations, 60,000 more surgical appointments, faster cancer care, 5,500 more doctors and nurses, and free GP visits and prescriptions for 750,000 children. Only a national government can both handle the country's finances and deliver more services.
Order. Supplementary question.
Thank you, Mr Speaker. If there is sufficient funding, why was Claire Davies, a 24-year-old who spent 1.5 years in pain waiting for an operation, told by her orthopaedic surgeon 2 months ago, quote, unfortunately, you are being adversely affected by funding limitations throughout the New Zealand health system?
The Honourable Dr Jonathan Coleman.
Canterbury District Health Board has admitted on the news on Sunday night that statement made by that surgeon was incorrect and should never have been sent to that patient, and that patient will be getting her operation, as she should have been in the first place.
Order. Order.
Point of order, Mr Speaker.
Point of order, the Honourable Annette.
Mr Speaker, I seek leave to table the letter to Claire Davies, dated the 3rd of July 2015, from her orthopaedic surgeon, saying funding limitations.
We don't need a description of it. Leave us sought to table that particular letter. Is there any objection? There is none. It can be
Supplementary question, Mr Speaker.
Supplementary question, the Honourable
Did
Annette
anyone
King.
in his office contact the orthopaedic surgeon who wrote the letter to Claire Davies, or did his office speak to the media about the surgeon in an attempt to warn the media off reporting this appalling story?
The Honourable Dr Jonathan Coleman. Either of those two supplementary questions?
No.
He'll be back. Order.
Supplementary question, Mr
Supplementary
Speaker.
question, Honourable Annette King.
Are 20 DHBs wrong when they report 160,000 people have been sent back to their GP without a specialist appointment, even though the data has been collected using the new Ministry of Health National Patient Flow data set, which he says will next year show the level of real unmet need?
The Honourable Dr Jonathan Coleman.
Mr Speaker, as the member well knows, always patients have been sent back from their GP. They were when Labor were in government, and actually no government's ever been able to supply all the operations that every person needs. But we are the first government to ever build a complete picture of that. The member knows actually that that picture is not yet complete, and the data will be available later next year. All we do know for a fact is we are doing more. So 60,000 more surgical appointments, 50,000 more operations, and 50,000 more medical appointments. So the only answer to unmet need is to do more. We're doing more. The Labor people did less.
Order. Order.
Point of order, Mr Speaker.
Point of order, the Honourable Annette.
I seek leave to table an OAA request from the Waitemata District Health Board dated the 21st of July 2015, stating the data was drawn from the National Patient Flow Project.
Order. Leave us sought to table that particular official information from the Waitemata District Health Board. Is there any objection? There is none. There is none. It can be tabled. Supplementary question, the Honourable Annette King.
Is Professor Phil Bagshaw, who runs the charity hospital in Christchurch, wrong when he said since 2008 the annual average increase in the number of people receiving a first specialist assessment is only on average 3.8%, but needs to be increased to 6 to 8% to keep up with baseline population increase and the ageing population?
Order. Questions are to be in order. Questions are to be in line with Standing Order 380. They're meant to be concise. The length of the supplementary questions from this member today are unacceptably long. I call on the Minister to answer.
Yes, but what is also correct to say is that back in 2007, the same Mr Bagshaw said unmet need is getting worse and the Labor government's doing nothing about it.
Question number 5, Dr. Jan Yang.
Thank you, Mr. Speaker. My question is to the Minister of Science and Innovation.